Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to share with you the worst parts about being a nurse. So what's the worst part about being a nurse? Well, that is a great question, but first I have to say that nursing is one of the most amazing professions on the planet. You know, I even made a video where I talked about some of the best things about being a nurse, because as a nurse you can work in all these different specialties, and if you get bored of one specialty you can move to another. Also, you get to help people and you even earn a pretty good salary. However, sometimes people wonder and ask me, what's the worst part about being a nurse? What do you dislike? And like with anything in life, there's going to be pros and there's going to be cons. For instance, like with parenting, I absolutely love being a mom, but there are some things I could definitely do without, like the sleepless nights, the whole birthing process you have to go through, those temper tantrums that you have to go through. If we could just eliminate all that, it would be awesome. But just like with nursing, there's going to be things that you like and you dislike. So what are the things that I dislike about the nursing profession? Number one, you can't save everyone. And if you're a new nurse, this is something that you really need to remind yourself from time to time, because I really struggled with this as a new nurse. Whenever I got out of nursing school, I had these ideas that these patients were going to come to me, they're going to be really sick, I was going to participate in their care with the other healthcare team members, and we were going to make them better, and they were just going to walk out of there. And I got to participate in that process. Now, sometimes this happens, and you do see a patient who is really bad off get better and go home. But a lot of times this doesn't happen, and they end up dying, or they end up being disabled, or something like that. And you can take that home with you, and you can feel really guilty about that and wonder, what did I not do? What did I miss? Like, if you have a patient crashing or there just something crazy happened during your shift, you'll always wonder, was it my fault? What did I do? And you can't do that to yourself, because you have to realize that every patient can't be saved, because we have such complex problems that go on in the human body, and it's just the process developing, and you have to give yourself some grace and allow yourself to be able to move on. Number two, you see the ugly side of life. So as a nurse, if you're in the profession for any amount of time, you are going to see some horrific things that can be emotionally hard to deal with. For instance, I have seen young patients who literally have their whole life before them, but they are so addicted to drugs, they can't get off them, and they're killing their body. Like their heart valves give out from where they're infected so bad from the drug use. I've also seen young mothers who have young children with advanced cancer, and they're not going to get better, and seeing them go through that, seeing the toll it's taking on their family is very hard. Also, having patients who leave this earth way too soon due to some freak accident, and seeing how the family has to deal with saying goodbye, and you seeing that as a nurse is just really hard. And then you have the cases where patients are healthy, but they've decided to do this medical procedure to see if they have some potential problem, but the medical procedure doesn't go very well, and they end up being disabled. So seeing all those things together and going through that with the patient, with their family, can definitely take an emotional toll on you as a nurse. And lastly, number three, the excessive expectations placed on a nurse can be very overwhelming, especially for a new nurse. So as a nurse, you have a lot of things that you have to do, especially depending on whatever specialty you're in. For instance, you have all these patients to take care of, and it depends, are you working day shift, night shift, how many patients do you have? So you have to provide care to them. You have a lot of documentation you have to do, admissions, discharges, medical procedures, and all the medications you have to give. And then you will have those crazy situations that you didn't plan on happening that will be thrown into your day. So it can cause a very chaotic day. And whenever you're new, just learning how to be a nurse and then trying to manage all that can be so overwhelming, because we have a lot of things we have to do. And I remember as a brand new nurse, this was one of the worst parts at the beginning for me, because I'm like, whoa, how am I going to get all this done? Especially when you come in and they're like, oh, well, you're down nurse and a nursing assistant. And it's like, oh no, how am I going to get all this done within this 12-hour shift? And so I would find myself, skipping lunch breaks because I have to get this done, or putting off going to the bathroom because this has to get done. And You want to be able to provide that great care and give those patients that one-on-one attention and make sure that you're looking at everything and you're finding out, you know, do I need to do this? Do I need to do this? Or am I missing this? You want to make sure that patient's getting the best care possible. And, you know, as a new nurse, that can be overwhelming. Now, with all of that said, you know, there are just so many great things about the nursing profession that really outweigh those cons that I just went over, because those three parts are things that I really found were the worst parts about nursing whenever I was a brand new nurse. But over time, I have seen, you know, yes, you can't save everyone, but you can try to do the best job possible. And yes, you're going to see the ugly side of life, but you're going to learn how to cope with that and mentally protect yourself so you don't go home with it. And expectations are always going to be high in nursing, especially as technology advances, the more we know about disease processes. But as you're in it, you're going to grow and you're going to be able to learn to manage your time efficiently. And you're going to learn how to meet these expectations. And you're even going to surprise yourself and be able to do things that you never thought were possible. Okay, so that wraps up this video where I discuss what I think are the worst parts of being a nurse. Now, I'd love to hear from you all what you think the worst parts about being a nurse. So comment in the section below.